Welcome to our exploration of bone injuries, a topic that affects nearly half of all adults in the United States. Musculoskeletal disorders are not only common, but they also come with a hefty price tag, costing billions in treatments each year. In this video, we'll break down the most common types of bone fractures, what causes them, and how they impact our daily lives. Whether you're a student, a healthcare professional, or just curious about how our bodies work, this journey through the biomechanics of bone injuries will give you valuable insights. Let's start by understanding what a fracture really is and why it matters. Fracture is essentially a break or disruption in the continuity of a bone, but not all fractures are the same. The nature of a fracture depends on several factors, including the direction and magnitude of the force, how quickly the force is applied, and even the health and maturity of the bone itself. For example, a young healthy bone might react differently to stress than an older or diseased one. Understanding these differences is key to diagnosing and treating bone injuries effectively. Next, we'll look at how different types of loading can lead to specific fracture patterns. When a bone is subjected to excessive bending, it tends to fracture on the side that's loaded in tension. Imagine bending a stick until it snaps. The side that stretches the most is where the break usually happens. In some cases, a tendon or ligament might pull so hard on the bone that it actually pulls a small chip away. This specific injury is known as an avulsion. These types of fractures are common in athletes and people who experience sudden, forceful movement. Let's see how these forces play out in real-life scenarios. Excessive bending and twisting or torsional loads can produce what's called a spiral fracture. This type of fracture often affects the long bones in our arms and legs. When forces are applied from opposite directions at the same time, they create a bending moment that can twist the bone until it breaks in a spiral pattern. These injuries are often seen in sports or accidents where the body is in motion and suddenly stops or changes direction. Let's take a closer look at what spiral fractures look like. Here you can see clear examples of spiral fractures. Notice how the break wraps around the bone, almost like a candy cane stripe. This unique pattern is a direct result of the torsional forces at play. Spiral fractures require careful medical attention, as the twisting can also damage surrounding tissues. Treatment often involves immobilization and in some cases surgery to realign the bone. Understanding the mechanics behind these injuries helps in both prevention and recovery. Not all fractures are complete breaks. In children whose bones are more flexible and contain more collagen, we often see what's called a greenstick fracture. This type of fracture is incomplete and usually results from bending or twisting forces. Imagine trying to break a young green branch. It bends and cracks but doesn't snap in two. Greenstick fractures are more common in kids because their bones can absorb more energy before breaking completely. Let's look at some examples to understand this better. Here are some visual examples of greenstick fractures. Notice how the bone bends and cracks but doesn't break all the way through. This type of injury is less severe than a complete fracture but still requires proper care to ensure the bone heals correctly. Children with greenstick fractures often recover quickly, but it's important to monitor healing to prevent future complications. Let's move on to another type of bone injury, stress fracture. Stress fractures occur when bones are subjected to repeated loading, either in magnitude or frequency. Over time, this can cause microdamage within the bone. If the bone doesn't have enough time to repair itself before more stress is applied, these tiny cracks can accumulate and lead to a full-blown stress fracture. This type of injury is common among athletes, military recruits, and anyone who suddenly increases their physical activity. Let's see what stress fractures look like and how they develop. Here are some images that illustrate stress fractures. You'll notice small cracks or lines within the bone which are the result of accumulated microdamage. These fractures can be tricky to diagnose because they often start as minor pain or discomfort and worsen over time. Early detection and rest are key to preventing more serious injury. Now, let's look at some other types of bone fractures you might encounter. Let's talk about two more types of fractures, fissured and comminuted. A fissured fracture is an incomplete break that runs along the length of the bone like a crack in a stick. On the other hand, a comminuted fracture is much more severe. It's a complete break that shatters the bone into several fragments. These injuries often result from high-impact trauma, such as car accidents or major falls. Both types require immediate medical attention and often involve complex treatment plans. Transverse and oblique fractures are two more patterns you should know. A transverse fracture is a complete break that occurs at a right angle to the bone's axis. In contrast, an oblique fracture happens at an angle other than 90 degrees. These differences in fracture orientation can affect how the bone heals and what treatment is needed. Understanding the direction and nature of the break helps doctors choose the best approach for recovery. Type of fracture a person experiences depends on several factors. These include the direction and magnitude of the force, how quickly it's applied, and the health of the bone. For example, a sudden high-impact force is more likely to cause a comminuted or transverse fracture, while repetitive lower magnitude forces can lead to stress fractures. Age and bone health also play a significant role, with children and older adults being more susceptible to certain types of breaks. After a fracture, the body immediately begins the healing process. This involves several stages, starting with inflammation followed by the formation of a soft callus, and eventually the development of new bone tissue. The speed and success of healing depend on the type of fracture, the person's age, nutrition, and overall health. Proper immobilization and sometimes surgical intervention are necessary to ensure the bone heals in the correct alignment. Exercise plays a crucial role in maintaining strong, healthy bones. Weight-bearing activities like walking, running, and resistance training stimulate bone growth and increase bone mineral density. This makes bones more resilient to fractures and other injuries. On the flip side, a lack of physical activity can lead to weaker bones and a higher risk of fractures, especially as we age. Let's explore how movement keeps our skeletons strong. On the other hand, environments with little to no gravity, such as space, can have a negative effect on bone health. Astronauts experience bone loss because their skeletons aren't subjected to the usual forces of gravity. This leads to decreased bone mineralization and a higher risk of fractures upon returning to Earth. Scientists study these effects to develop better ways to protect bone health during long-term space missions and for people who are bedridden for extended periods. Bone is a living tissue that constantly remodels itself in response to stress and strain. When bones are loaded, they adapt by becoming stronger. If loading decreases, such as during prolonged bed rest or space travel, bones lose density and become weaker. This dynamic process is essential for maintaining bone health throughout life. Understanding bone remodeling helps us appreciate the importance of regular movement and proper nutrition. Preventing bone injuries starts with a healthy lifestyle. Regular exercise, a balanced diet rich in calcium and vitamin D, and avoiding risky behaviors can all help keep bones strong. Wearing protective gear during sports and being mindful of fall risks, especially for older adults, are also important steps. Early detection and treatment of bone health issues can prevent more serious injuries down the road. Certain groups are at higher risk for bone injuries. Children, due to their flexible bones, are more likely to experience greenstick fractures, while older adults are at risk for osteoporosis-related fractures. People with chronic conditions like diabetes may also have compromised bone health. Understanding these risks allows for targeted prevention and treatment strategies tailored to each population's needs. Diagnosing a bone fracture typically involves a combination of physical examination and imaging techniques like X-rays or MRI scans. Doctors look for signs such as swelling, deformity, and pain at the injury site. Accurate diagnosis is crucial for determining the best treatment plan and ensuring proper healing. Advances in medical imaging have made it easier to detect even subtle fractures that might otherwise go unnoticed. Treatment for bone fractures varies depending on the type and severity of the break. Simple fractures may only require immobilization with a cast or splint, while more complex injuries might need surgical intervention. Pain management, physical therapy, and regular follow-up are all part of the recovery process. The goal is always to restore function and prevent future complications. Summary: bone fractures come in many forms, each with unique causes and treatment needs. Understanding the biomechanics of bone injuries helps us prevent, diagnose, and treat them more effectively. Remember, strong bones are built through regular exercise, good nutrition, and healthy habits. Stay informed, stay active, and take care of your bones. They're the foundation of your movement and health. Thanks for joining us on this journey through the fascinating world of bone biomechanics.